Good afternoon, everyone. Today I will be presenting a seminar on artificial intelligence in psychiatry, current status and future perspectives. We will be basically looking at what is AI. We will be looking at the different components of AI. We will be looking at AI in medical field, AI in psychiatry, then AI in India. We will be looking at future direction, summary, and then the references. So what is AI? So AI defines AI as a branch of computer science focused on creating systems or machines that can perform tasks typically requiring human intelligence. These tasks include learning, reasoning, problem solving, understanding natural language, recognizing pattern and making decisions. AI basically is a higher form of computation. Whatever level of computation that we have had till now, AI is basically just an upgrade to that. It can be basically be broken down into 4 or 5 different components. It can be used for machine learning. Machine learning is what enables us to learn and interpret data. So you can give AI an exceptional amount of data and it will analyze the data. It will try to find common links between the data and it will tell you the characteristic feature of that data. Then it can be used for natural language processing, machines understanding and learning human languages. So a lot of glasses have come up which have in real-time interpretation of languages, wherein the person in front of you is saying a certain language, and in front of your glasses you can just see whatever the other person is saying. Then there is computer vision, robotics, and expert systems. This is again what I have explained in a better detail. We can see that machine learning can be supervised, unsupervised, and reinforcement learning. Then there will be natural language processing, computer vision, robotics, and expert system. We will be getting into detail into a lot of these things. Now the broader types of AI. AI can be broadly be divided into a narrow AI or a general AI. A narrow AI is something that has very specific tasks that you can give it to it. Like, if you need some spam filter AI, you can have fraud detection systems. Something that is very specific and is designed for a specific task. So that becomes a narrow AI. As you can see, there is high task specificity in narrow AI. There is non-human like cognitive abilities. So it is only designed to perform one single task. It does not do a lot of computation. It does not do a lot of things. It will only tell you what it is designed to do for. General AI is what we are trying to move towards. Even today, we don't have a complete general AI which is made, which will be able to understand, interpret, do everything on its own. Even if we see a lot of AI softwares that are there, they are more of narrow AI giving us results based on what we have been asking. Now let's look broadly at AI in medical field. We will then later on dive into AI in psychiatric field. AI is poised to bring transformative changes in the field of medical. Now we can use AI for medical documentation. It will analyze a lot of medical documentation. It can be used for health insurances. You can build a certain AI which will process all of your fraud claims. So all of your analysis and the time taken to give a decision on your health insurances decreases. Then it can be used for analyzing medical images. Like we had seen machine learning. A lot of machine learning algorithms are based wherein they have fed the machine a lot of x-rays and a lot of CT scans, and then the machine has been able to learn through recognizing and analyzing all of the images and are now able to do some level of interpretation of those reports. Then it comes into data analysis. A lot of things that we humans might not be able to correlate, or we might not be able to find the link between, could be found out by AI. Then healthcare management systems, electronic health records. So this is something that is basically the application of AI broadly into the medical field. Now AI in psychiatry broadly. The global prevalence of mental illness, including India, is experiencing a significant and concerning rise. We know that the mental illness burden has been climbing year by year, whereas the number of psychiatrists per lakh population is very less, 0.75. This is where we can use the AI to fill in the gap. While the exploration of using AI in mental health is still in its early stage, there are various needs that AI can help in psychiatry, such as looking at how things such as electronic health records, services, surveys, brain scans, social media, sensor-based tracking systems can be helpful in predicting, categorizing, or forcing mental illness, such as depression and psychosis, or even the chances of someone attempting suicide. AI in psychiatry. Now here I found in one of the journals a basic uh, list of AI softwares or AI applications that have been used for different things. Like for mental illness, there is a Mind LAMP, which is a Android and iOS based app. You can download it and you can use it. It collects a lot of neuropsychiatric information. It analyzes it. Then there is robot Casper, there is Wobot. Wobot is basically something that has been used to apply CBT to the patient. So these are various things that have been used in AI in psychiatry. Although use of artificial intelligence technology has become quite popular in medicine for physical health application, but in the discipline of mental health, its use is much restricted. Mental health relies on softer skills like rapport building, forming relationship with patients, and observing patients' emotions and behavior. Clinical data of mental health is more subjective and qualitative, like patient statements and written notes. But still, mental health has a lot of benefit from artificial intelligence. Artificial intelligence has immense potential to redefine our diagnosis and help in better understanding of mental illnesses. A person's mental health depends on her unique biopsychosocial profile. We have comparatively narrow understanding of the interaction between these biological, psychological, and social systems. There is substantial heterogeneity in the pathophysiology of mental illness and identification of biomarkers. Artificial intelligence technologies may have the ability to develop better pre-diagnostic screening tools and work out risk models to determine an individual's predisposition for or possibility of developing mental illness. So basically a lot of these things that we might miss, the metadata analysis can be used and analyzed through AI. Now we will get into the specific disorders in which we can use AI. AI in affective disorders. Now much work has been done using artificial intelligence on affective disorders. EEG has been used extensively to study mental illnesses such as depression, as it is non-invasive, portal and inexpensive method, and also because it has high temporal resolution information. So what they did was they did an EEG. Based on that EEG, they made a individual image of a person and they made mappings for every individual person. Then they used 4 to 5 different types of machine learning languages, and on that they were able to predict, just on the basis of an EEG, if a patient has depression or a patient does not have depression. And it was found that they were able to discriminate depressive patient from healthy controls with an accuracy of more than 90%. So we can implement such tools like an EEG, which is not traditionally used for the diagnosis of depression, and repurpose it to have a better predictor of depression. The 3D and 2D are basically the different algorithms that they have used, and the studies have proved that these network systems can accurately predict depression from video segments. Machine learning algorithms have been used to forecast BMI values based on psychosocial variables like depression with an accuracy of 80%. So what they did was they analyzed a lot of people's BMI, they fed it into the system, and they used psychological variables like depression and other variables, and they were able to predict that what a person's BMI might be depending on the psychological variables. So the analysis of all of this metadata, if done without AI, would take you a lot of time. Whereas if you just put it into a machine learning language, the analysis becomes much easier. Other diagnostic and predictive purposes, artificial intelligence supported virtually embodied psychotherapeutic devices are rapidly developing. For example, apps such as Tess and other chatbots such as Sara, VBot, Vyasa, which work over short messaging service text. So these are basically web-based apps, and what they will do is that they will uh, give you some kind of therapy. Like if we take the example of VBot, it will administer you CBT, and based on your facial expressions, a lot of variables will then change. So it is basically constantly in real time reading your facial expressions, and based on your facial expressions, it is going to give you certain responses. The AI has been coded to be as empathetic as possible and as close as possible. Though one of the main problems that have been seen with the chatbots is the adherence. A lot of patients do not adhere to it because at the end of the day, there is not a human presence on the other side. The VBot engages with patients in the form of virtual psycho review and helps patient to identify their emotions, patterns, and to learn skills such as resilience or methods to reduce anxiety. This is another similar application. Now AI in psychotic disorders. Machine learning algorithms have successfully discriminated healthy patients from patients with psychotic disorders with the accuracy of more than 70%. So all of these data is basically, all of this statements are basically when the AI has been analyzing a lot of your data which initially we were not able to analyze and creating links between data which we previously did not think about. Artificial intelligence has been used in studies to assess disordered language production and to differentiate speech samples of patients with psychotic disorders from healthy patients. So a lot of your formal thought disorders and your incoherence in speech and all of these things are now being studied by AI, and they are trying to find certain links and they are trying to find certain predictors using the incoherence of language to see the level of psychosis, the predictive pattern of psychosis and such. Now, avatars have been successfully used in treatment of schizophrenia to improve medication adherence. Now, whenever the word avatar comes, always think about a virtual reality software. So it's like a virtual reality thing that you put on your face, and it can be used for different things. So like in schizophrenia, you can use it for the uh, for the uh, for like the therapeutic form for the auditory hallucinations. Similar to the Avatar project, virtual reality assisted therapy for schizophrenia usually encourages patients to engage with the voices they hear through the use of AI avatar. Studies have found that this therapy could help in developing therapeutic targets. Now what they did was to check for the auditory hallucination score. So there is a Pirate scale which rates the auditory hallucinations, and they did supportive counseling and avatar therapy, and they saw that if you do supportive counseling, the drop of total distress and frequency is much better when done it through the VR system than done through the supportive counseling for auditory hallucinations. So in the future, we could have these softwares directly installed in your virtual reality devices, and we could then give the therapy to the schizophrenic patients for auditory hallucinations. Similar to the Avatar project, virtual reality assisted therapy for schizophrenia, okay, this we have already seen. Studies have found that this therapy could help in developing therapeutic target. Virtual reality therapy has helped in improvement of symptoms like visual and auditory hallucinations, depressive symptoms, and in overall quality of life, particularly in difficult cases of schizophrenia like treatment resistant schizophrenic patients. Now AI in child and adolescent disorder. Machine learning techniques have successfully been used to differentiate ADHD from healthy control and in classification of ADHD subtypes based on superspectra of EEG measurements. Again, they have used the machine learning algorithms to have predictive forms, and they were even able to identify the different types of ADHD in people using the EEG readings. The measurements are taken for 4 different conditions, 2 resting conditions and 2 neuropsychological tasks. Now the next one is robot mediated interventions. Now robots are used for children with ASD. 6 roles for Casper were identified. We will next see the Casper robot, in which there were provoker, reinforcer, trainer, mediator, prompter and diagnostic information provider. So in children, we can also use certain robots, and we can then code the robots with AI ability to have real-time responses. Strengths of Casper are related to personalization possibilities, its playfulness, its action reaction principle, its neutral expressions, consistent and repetitive applications of action, possibility to vary behavior in a controlled manner, and having an extra hand. However, certain challenges are limited reaction possibilities, likelihood of children being afraid of Casper, difficulty with generalization of transfer, and potential dependence on Casper has also been identified. Here we can see that this is the robot Casper. It looks a little scary, but apparently the autism spectrum children have been responding very well to the robot, and the robot has then been coded with a lot of activities wherein a lot of repetitive activities are done by the child, which might tire out the adult or which might frustrate someone else, but the robot has none of those emotions. Robotherapy is another example of socially assisted robotics, which was designed to help children with ASD to develop social skills, and robot now helps in enhancing facial recognition and appropriate gaze response. Social interventions mainly aim at improving social skills like imitation, taking turns, staying engaged, and empathy, with the target that children can then apply these learned skills to their relationships with human peers. Now, initial studies have been very promising, and the ASD children have been seen to perform better with robotic partners compared to human therapists. They respond with social behavior towards robot, and their spontaneous language have improved during therapy sessions. There is another project that has been going on in France called as the Dream Project, which aims to investigate the clinical utility of robot assisted therapy, delivering within a supervised autonomy framework. They have deployed it in a few schools. Now this is the robot now, and as you can see, it is a much better looking robot, and it has the eyes feature, and depending on the children's response, the robot is also able to respond. So you can see that the size of the robot. So what they do is that the robot is supposed to come into the classroom 2-3 times. He goes around, he interacts with the children. So this is a special kindergarten class in Quittany, France. In the classroom now comes 2 to 3 times a week for the morning ritual. It is the welcome time when it is a welcome time for the children, and the children are gathered. The robot comes to say hello, gives the date and time, and sings for gestural imitation. So it is more of like the patient has been able to the patient is helped to socialize much better in that environment. Now AI in geriatric psychiatry. Apparently the geriatric psychiatry robots are much better looking than the ones that they have designed for children. Now what they have done are design companion bots or companion robots for geriatric psychiatry. Here we can see that there is a therapeutic seal called as Paro. It has a lot of good things. It has a speaker, it has an alarm system. So artificial intelligent animals like robots such as Paro, eBear engages individuals and as at home care assistants, respond to speech and movement with dynamic dialogue, or assist in helping elderly or depressed patient by providing companionship and interaction. Studies have found that such robots are fruitful in reducing stress, agitation, and loneliness, and improve mood and social connections. So these are certain robots with AI features which can be given to the old age patients, and as we know that the old age patient need assistant, they need a certain they have a certain amount of loneliness in their life, so certain e-robots or companion bots can be given to the old age patients. Now in addiction psychiatry, again there has been a lot of research on the research front that has helped in analysis of the data. The research on psychoeducation delivery have found that text-based conversational agents can lead to a higher program adherence compared to verbal presentation. Also, such conversational agents cause significant reduction in substance use and craving. So we can have an AI developed in someone's phone, or we can have an AI website wherein we can register all of the substance users, and then they can continuously come, they can tell their feelings, they can talk about it, and depending on that they will get certain responses. Now, drug repurposing is a strategy that can help identify potential new therapies for complex diseases. What is drug repurposing? A drug that has already been used for some other purpose through research can then be repurposed for something else. So oftentimes to develop a certain drug, we need billions of dollars. Instead of investing billions of dollars into developing a new, altogether new drug, we can use the machine learning algorithms and AI to scout and research all of these already existing drugs and see their efficacy across different platforms and try to repurpose the same drug onto a different type of treatment option. An integrated drug response strategy with combined computational based drug prediction, patient electronic health records, based clinical corroboration and mechanism of action analysis was used in the study, which could identify 5 repurposed candidate drugs for treating opioid use disorder patients. Now AI in sleep. ISR, information support robot, has been used to influence the daily activities of older people. Now, a lot of sleep disorder comes down to your sleep wake time, your daily activities, your mood, the way you are going throughout the day. So, with changing times, the proportion of older people living alone has increased. Living alone in old age increases the risk for cognitive dysfunctions, low mood, and disturbed sleep wake cycles. Robots can support older people in maintaining their independence and daily activities. Older people with balanced daily activities have been seen to have lesser disturbance of sleep wake cycle. So in older people, if they have a certain structure to their day, their sleep wake cycle will be much better. Now information support robots have been used to remind people to wake up, go to bed, eat. And study has shown that use of ISR subjects showed faster wake up times, decreased sleep duration and improvement in amount of activity during the day. Now this is an example of ISR, Papiro, developed by the NEC Corporation. So if we can see that there is an algorithm that has been designed, and that is the information support algorithm. This algorithm is then fed into the robot, and the robot will then give you certain cues. You know, it is your time to eat, it is your time to take medicines, it is your time to go out and have a walk. You've already have a walk, you've already had a walk, you've already eaten medication. So all of these things the robot will tell the old age patient, thus will help him in regulating his day-to-day activities and also forming a particular structure to it. It will also be able to analyze that okay, this certain person is not able to is not taking his medicines always on time. Here in the research that they had done using the robot, they used infrared sensors in the different parts of the house to see the movement of that person across the house. And the study demonstrated that an ISR influenced the daily activities of older people in their actual living environment. Older people who maintained their cognitive function, that is the MMSC J score of more than 24, showed faster wake up time, reduced sleep duration and increased amount of activity during the day after introducing the ISR. The results suggested that ISR is beneficial in supporting the daily independence of older people living alone. The effect of ISR were particularly dependent on cognitive function, as the ISR changed the daily activities of older people who maintained their cognitive function. Now AI in anxiety spectrum. Artificial intelligence models have been used in times of COVID-19 to investigate predictors of fear and perceived health. Using machine learning results showed that the model could accurately predict fear of virus using factors such as worrying about shortage of food supplies and perceived health factors like physical exercise, attachment and anxiety. Now again coming back to the avatar coaches, the virtual reality thing, this has been also used for the treatment of fear of heights as part of an immersive virtual reality situation. So what they did was they designed a certain software called as Now I Can Do Height, and it had basically five different floors. They mapped the baseline, and as you do the levels, there are different tasks on each floor, and as you complete the task, you will be progressing to the next floor. And only after finishing all the tasks in the first floors can you go to the sixth floor. Now, depending on your response in real time, like if you are wearing the goggles, did you take off your shoe at certain point? Did you flinch? Did you bend? Did you move your hand? Depending on your real time responses, the type of activities or the type of tasks that will be fed to you will completely differ. And the sequence of the tasks are also completely different depending on each and every move that you're doing. An automated psychological intervention delivered by immersive virtual reality is highly effective for reduction of fear of heights. All participants were followed up at every time point, meaning that the treatment effect estimates were unbiased by missing data. Treatment uptake was very high, indicating that the VR intervention was well received. Level of discomfort after a VR session were very low, particularly since trial participants were facing their feared situation. Now, this is not based on exposure. This is based on repeated activity. So you are made to do a certain repeated activity, and through doing that repeated activity in a virtual environment, so in a much safer environment, you are made habitual to certain things. So without AI, you would never be able to predict what activity someone should do, what next activity someone should do, the analysis of every movement, the analysis of every breath. Here we can see the data that they have put out. VR treatment at 0 weeks, at 2 weeks, and at 4 weeks. So there is a significant drop in the HIQ score. HIQ is basically the index which measures your fear for heights. Now, Indian research on AI and mental health. So we've also done a lot of research in our own country. Studies related to artificial intelligence and mental health are limited in India. However, research has boosted in the recent decade where artificial intelligence have been used for diagnosis and classification of schizophrenia based on EEG. So here we are seeing a certain theme which is occurring, that they are trying to repurpose the EEG and the EEG models and the mappings and the images of the EEG to have predictive models and try to drive it towards a more diagnostic tool for assessment of cognitive and functional impairment in Alzheimer's disease and for differentiation of depressed patients from normal subjects based on EEG. In India, machine learning techniques have been used to explore abnormalities in microstates that can identify patients with TLE in the absence of an interictal discharge. Artificial intelligence has been used to find potential markers like retinal vascular changes in patients of schizophrenia and bipolar disease. Artificial intelligence have not only been used to detect depression, but have also proven its efficacy in classification of severity of depression. Machine learning methods have been successfully used for diagnosis of dementia, to differentiate adults with ADHD from healthy controls, and to predict depressive systems in postpartum. During the COVID times, machine learning methods have been used to detect burnouts in healthcare workers. Now, before coming to the advantages of AI, I put a link on the departmental group. It is basically a link which will have the reference of all of the articles. Now, before the advent of AI, I would not have been able to make a separate website for it. But now, because of the note-taking app having the ability of AI in itself, I was just able to tell the note-taking app to make a website out of it. It made a website and it gave me a link which I put it on the group. So whatever articles and all, I could very easily just document it and make it into a website. Before this, it would have taken me to hire a coder. The coder would have written the website and then made a website and would have probably taken me a lot of money. But due to the advent of AI, a lot of these tasks have now been automated and are much cheaper. So that is something that I found as a very good advantage of AI. Now the other advantages of AI are affordability. Now obviously, unlike traditional counseling, you have to have a person, you have to pay the person, and you have to schedule appointments, you have to travel. All of those things will not be required once the AI comes into being. Accessibility, again we had seen that there are only 0.74 psychiatrists per lakh population. So there is not, I could not find the exact data on psychologists, but considering that a psychologist data would also not be very good. So the access to psychiatrists and psychologists could also be increased using AI. Privacy and ease of opening up. AI-based therapies make people feel less self-restrained when they may need to share embarrassing detail. This is especially important for those who can feel ashamed in face-to-face interaction because of stigma or fear of being judged. Actually, almost a quarter of people lie to doctors, with the most hushed topic being smoking, drinking habits, and sexual activity. For many, it is easier to admit the true extent of their behavior to a robot because the robot would not judge. We even we say that a psychiatrist should not have any judgment on the face. So if we look at AI, it would completely remove that judgment altogether. And then support for therapists. We can have certain software which will again support the therapists. Now, efficiency. Artificial intelligence algorithm for mental health care have already been proven to be successful in detecting symptoms of depression, PTSD, and other conditions by analyzing behavioral signals. Other studies have shown that algorithms can spot behavioral symptoms indicative of anxiety with over 90% accuracy, and some even 100% accurate at predicting who among at-risk teens is likely to develop psychosis. They also help patients struggling with mental distress. This is again RCT done on the VBot. Now we've looked at the advantages of AI. We should also look at the disadvantages of AI. Now a lot of psychiatry is based on your softer skills like rapport building, forming relationships with the patient, observing a patient's emotions and behavior. So the use of artificial intelligence technology though has become quite popular, but in the field of psychiatry there are some restrictions because of this. The lack of human empathy and compassion, which are crucial components when treating patients who have suffered mental trauma or are experiencing a mental condition. With dependency on online servers and database, there is a risk of patient privacy. Just back here, we were discussing that AI might help in patient privacy, but there will be somewhere that the AI will have to store all of this data. And that data at the end of the day is not completely unhackable. So there is some risk of patient privacy. India recognizes this issue. The Ministry of Health and Family Welfare has released a draft of Healthcare Security Act, which besides maintenance of electronic health record standards, also proposes penalties for data breach. Still, the regulatory framework in India needs upgradation with developments in AI. So it is a lot of our laws and bylaws and the framework which has been designed are designed for doctors. We are not really well prepared for the advent of AI. There is a lack of guidelines specific to various assistances received by mental health professionals who deliver AI services. Now, if a doctor makes a mistake, there are laws which will penalize the doctor. But there is nothing that has been written in the Indian law wherein if an AI makes a mistake, how will you penalize the AI? However, if a similar glitch occurs due to technical malfunction, laws are not defined to hold the software developer accountable. Now, what is the future of AI? I feel like AI itself is a very futuristic branch. A lot of things that we have discussed are something that are in process, which will be applied and implemented and perfected in the future. Still, one far off thing that we can say is that right now we have artificial intelligence. We might move towards artificial wisdom, or what we say as general AI. The functioning of AI currently is limited. However, its greater advancements and applications are expected in near future. It is not mere intelligence that best speak to the technological need of the society, but wisdom that is related to noteworthy happiness, well-being and lifespan of an individual and society. The key objective of artificial wisdom would be to serve as assistants to people to make a better world. Their component would include pro-social behaviors, empathy and kindness, self-reflection and enthusiastic control, accepting different qualities of perspective, definitiveness and social prompting. Now this language has also been used because a lot of people are fearful that we will have some kind of Terminator like situation and Genesis and Skyrocket will be formed. So whatever AI, generative AI, the narrow AI, general AI and artificial wisdom that is being built has been built with the certain rules of artificial intelligence. And some of them are, pro-social behavior, the fact that, the AI should not harm a human being, all of those things. So in summary, I would say that it is at this point It is almost impossible for us to avoid AI, and we are at a phase in our life wherein as the future progresses, the amount of AI integration in our life will keep on increasing. Like right now, also we have a app called as Rejoice, which is approved by FDA for the treatment of MDD, major depressive disorder. So it also uses some AI components. So even the FDA and other governmental bodies will now start granting, will now start accepting these treatment modalities which have some bit of AI in it. So just like for radiologist, a radiologist with AI will only survive. In the same way, a psychiatrist with AI is the psychiatrist which will survive. Thank you.